Good afternoon, everybody. Thank you so much for joining us this afternoon. Wherever you are in Australia, I'm in Melbourne. We've got representatives all across the country because that's how, the Pearcey Foundation organises itself virtually across the country. So we're really excited to have you here with us this afternoon to continue the conversation around such an important step for the country as we move into the next phase of living through coronavirus and COVID-19. The role that technology can play in actually getting us back on track, but also creating a safe environment for us to get back onto our business and our lives and the rest. So we've been having a conversation, a robust debate and an interesting, thoughtful discussion across many different sectors and experience points from the Pearcey community. And we wanted to continue this in another forum. We've done it through some collaboration through collective writing, which of course, as many will know, is an interesting process. So the fact that we've come out with two pretty substantial pieces of thinking is a commendation to everybody for wanting to be able to take on and really try and nut out some of these issues around trust. Because in the end, that's really what we feel that it really boils down to. So I'm very happy that we have some of our leading lights in Australian tech sector here. We have Dr. Ian Oppermann, who is the ACS president, and also with the New South Wales government as chief data scientist. And he's also an industry professor at UTS. Mr. Paul Gampe, who's the global chief technology officer at PCCW. You've got to make sure you get those acronyms right, and also global, and also the chair of Pearcey Queensland. And Dr. Elaine Saunders, who's the co-founder of Blamey Saunders Hears. She's an adjunct professor down here at Swinburne Uni and a professional director and a NATSI fellow. So I'm very pleased to have you all join us and coming from different perspectives, because that's really what is a strength of the discussion for the Pearcey Foundation. So I'm going to hand over to Ian first to set the scene from the perspective of privacy and data.
Thanks very much. So last week was the week before, was Privacy Awareness Week, all throughout Australia and in fact throughout the globe. And we held an event at the end of Privacy Awareness Week, which really talked about aspects of privacy in the digital world, aspects of privacy in a world where there are more and more ways that we can reveal personal information, and there are more and more ways that we do reveal preference, and we do reveal activity, and we do reveal relationships, whether it's knowingly and willingly through Facebook or whether it's through captured, de-identified data. Leading up to the Privacy Awareness Week event, we ran a series of masterclasses which looked at privacy enhancing technologies, the so-called PETs. We also looked at a range of different social, ethical, and legal factors. And realistically, the environment we live in is very, very different from the world that privacy legislation was contemplated in. And the ability to adapt to that modern world where there are so many different sources of and surfaces for revealing data, mobile phone data, this data right now that's being streamed, means that there is no way to say comprehensively there is a technological basis for capturing, protecting, and preserving data. There are many, many different environments where our ability to reveal information about ourselves is increasingly made possible, unintentionally or intentionally. A lot of the conversation really was around what should we be doing? What does it mean to maintain personal information in the modern world? What does it mean to think about appropriate use of data in the modern world? And most of the conversation was really what ought we to do? How should we protect? What is appropriate use? How far should we go? And in particular, when we think about uses of data for analytical purposes, for personalization of services, for some really good and useful things, the question always is, how far should we go? Is it appropriate to take a data-driven insight and use that to provide a better service for an individual? Is it appropriate to take that all the way through to a data-driven decision? And under what circumstances do we need to think about those data-driven decisions? And ultimately, what should we do if something goes wrong, if there is an unintentional harm, if that harm is irreversible, if that harm is reversible or it's reversible with some cost? So there's a much bigger conversation that we've been having around the frameworks. What are we doing? Why are we doing it? How do we test the purpose of the use of data? How close are we to having personal information in those linked de-identified data sets? And how sensitive is that data in terms of the necessary quality, in terms of the appropriate use, or in terms of those unintended harms? So we find ourselves in a very interesting situation. We had been slowly but surely building through the Australian Computer Society, working with many different state and territory governments, building data sharing and use frameworks, working with international standards community to try and build out frameworks of governance which are appropriate and enable the use of human judgment, but are informed by quantified measures for the amount of personal information in a linked de-identified data sets, a so-called PIF, which we've been looking to standardize with the international standards community, but also frameworks which consider the sensitivity of the data itself or of the intended use of the insights, and building governance frameworks that we can map out depending on whether it's highly personal but low sensitivity, high personal, high sensitivity, low personal, high sensitivity, or the sort of things we want to put out increasingly for open data. And over the last few months, we've rapidly accelerated some of those frameworks, rapidly developed the personal information tools to measure the amount of information that's released. And we've learned a lot. But what's really obvious is that we are never going to be there in terms of technology or frameworks for personal information and use of data. We're always going to be, in some senses, catching up because technology is moving so quickly. So it's a really interesting time, and it's really interesting, and I think an appropriate conversation to have around the use of data and personal information in a digital, hyper-connected 21st century. Now, Kelly, you're muted.
So thank you so much for that perspective. And it is good to, I mean, we don't exist in a vacuum, and Australia, is one of many countries that are looking at this issue. And so really understanding that being able to connect into that global conversation is really important. So thank you so much for sharing that insight there. So I'm going to hand over to Paul now, who's going to look at the security and the code and some of the real technical side of it that, again, is such an important part of this discussion. And it's just another dimension. So I'll hand over to you now, Paul.
Great, thank you. Good afternoon, everyone. I'm here today representing the Pearcey Foundation in Queensland. I'd like to share some perspectives on the security aspects of the COVIDSafe application. Confidentiality, integrity and availability, also known as CIA, is a model designed to guide information security assessments. These elements are considered the three most critical components for information security. In this context, confidentiality refers to the measures in place to limit access to information. Integrity is the assurance that the information is trustworthy and accurate. And availability is a guarantee that the reliable access to the information by authorized persons. So let's begin with confidentiality. When you install the application, you're asked to complete a registration process. Hopefully many of you have already done so. This registration process asks you to enter your name, which can be a pseudonym, your age range, your postcode, and your phone number. This is the most sensitive, personally identifiable information associated with the application. At the conclusion of the registration process, the application transmits this data to a central server using strong cryptography. Once the application is installed and registered, the next phase of its operation is to begin broadcasting a temporary identifier via the Bluetooth protocol. This temporary identifier is generated via the central server and is an encrypted token, meaningful only to the central server, where the key to decrypt the token is held. When another mobile device with the COVIDSafe application is within Bluetooth range, a proximity event is recorded. This proximity event contains the date and time of the event, the mobile phone model names of both devices, and a relative signal strength indicator, RSSI. The RSSI is later used to determine whether the two devices were within a 1.5 meters of each other. This data is recorded into a database on the mobile device and is not accessible to other applications on the device or to the central server. So during the installation, registration, and proximity detection phase, there are sufficient cryptographic and data storage controls in place to feel confident that the application is maintaining user confidentiality. So moving on to integrity, where integrity is the assurance that the information is trustworthy and accurate. As the federal government has chosen to base the COVIDSafe application on the Blue Trace implementation developed by the Singaporean government and released under the GPL v3 open source license, it's great to see that the federal government has honoured its licensing obligation to make the source code of the COVIDSafe application available publicly. This means that the Australian technical community has had the opportunity to verify line by line that the application does what the federal government said it would do, such as verifying the application deletes proximity records after a period of 21 days. Since the application's initial release, a number of software developers and technologists around Australia have reviewed the application in depth and collaborated, not only verifying that the application is doing what it's supposed to do, but perhaps even more importantly, have been able to identify defects and opportunities for improvement that I'm very happy to report the Digital Transformation Agency have taken on board and incorporated in recent subsequent releases from the initial release. As a result of the government's wise decision to adopt open source license, the Australian technical community have been able to contribute to verifying the integrity of the application. It's important to note, however, that the source code for the server side of the application architecture has not yet been made available to the technical community of Australia. And I would certainly encourage the federal government to consider making the server side source code also available so that we can assure fellow Australians of the integrity of the server side of the application architecture. The final element to consider is availability, which is the guarantee that reliable access to the information by authorized persons. When a user tests positive to COVID-19, at their personal discretion, they can choose to perform the final function of the application lifecycle, which is to upload their proximity records to the central server. These proximity records are transmitted again using strong cryptography, and the key to decrypt the temporary IDs allow the state and territory health authorities to use the data to begin contact tracing. So from my perspective, the key to assessing the availability of the data of the application is that the data is only made available for contact tracing if the user chooses to do so. And that access by the appropriate health authorities is protected by appropriate cryptographic controls. The integrity of these cryptographic controls could be further verified should the government choose to make the source code of the server-side application available. So in summary, given the risk-reward trade-off associated with any information security asset, the current confidentiality, integrity, and availability controls that are in place today give me confidence in recommending to all Australians that they should install the COVIDSafe application. There continue to be opportunities for improvement, such as the background Bluetooth performance on iPhone and potentially adopting a more decentralized architecture being proposed by Apple and Google. Should the federal government continue to engage the Australian technical community, I remain optimistic about the value of this application to our society. Thank you.
Great, thank you very much. And you know, I don't have that technical depth, so it's really great to hear the insights that you have and that assurances that you've seen across industry from a technical perspective of being able to do that reverse engineering and the like. And that, you know, that the DTA is open as much as it's able within those remits. I've got a question about that a little bit later, but I'll come back to that. So I'd like to hand over to Dr. Elaine Saunders now, who can bring in from that health perspective and of many of the experiences. Health is a major tech hotspot, let's say. And so I'm sure that Elaine will give us some insights there.
Thank you. Okay, so I think, yes, I'm given the very untechnical version. I'm here as the health person, and perhaps particularly I'm here as someone who's run a digital health or telehealth company for 10 years, where we supplied hearing aids direct to the consumer with a very simple app and readily available telehealth support, almost on demand. And our customer group were around the ages of 60 to 70 on the whole. So it's given some insights into adoption. I think implicit in the talk I'm going to give, though, is that it's all about risk and benefit, as Paul alluded to. It's not as simple as the risks and security. It's about risk and benefit. So I want to focus on adoption and adherence, and I want to talk about adoption or lack of the app. And I think overall, my view is expressed very well in the title of the Pearcey paper. It's a matter of trust. It is absolutely a matter of trust. It's also a matter of knowledge, and I fear we might be overestimating it. Anyone in marketing knows that marketing is about creating a want or a need for a product. A government product isn't actually any different. Our current federal government knows they don't enjoy a particularly high level of trust, although it's very much on the rise. So they needed a very clever strategy to get adoption of the app and usage of it, especially one that that really appears to collect data. We raised the topic of the Bushfire Act recently, which to the general public looks as though it's giving you data. And quite honestly, I think if it was taking lots of my data, I'd still sign up for it and look at it every day, because it's kind of absolutely clearly and compellingly life or death for me. So I think that what the government needs to do was not to underestimate the competition they have from people who can't see the benefit of taking what might be seen as quite extreme action to tackle the virus. And if people have lost their jobs, as many have, those people have to understand that things will actually get a whole lot worse economically if we don't get on top of things, rather than thinking, gosh, we must get out there quickly and back to work. But let's look quickly at another example of adoption of a health app. And of course, the big standout example in Australia is My Health Record. That's been a wonderful story of misunderstanding the stakeholders, that is the Australian population. Really, it's a very simple message. Sign up and use My Health Record, it might save your life. It's a lot less altruistic initiative than the COVID app, because it's about saving your own life. It's a tremendous opportunity, and it was not well done. The reality of the rollout is reminiscent of the website that nearly brought down Obamacare, where it was recognised that no one spending the $70 million budget that was there for the website had actually ever launched a startup. It was rescued by Marketplace Lite, who rewrote the Healthcare Gov website, starting as a startup, working like a startup inside the government. Not a terribly well-known story, though probably well-known to this community. The COVIDSafe app could be our most important startup in Australia ever. Who's running the company? If it's like My Health Record, we can predict its failure. Going back to My Health Record, the Digital Health Agency took the decision that the health professionals would educate the public. The health professionals didn't educate the public. There was no incentive to do so. In fact, medical professionals took to the privacy debate more than the general public did. Doctors have been managing their patients much the same way for hundreds of years. Why would they suddenly give this over to something vaguely called the cloud? A fundamental of marketing is to reach out to your customer. I'm not sure that the ADHA knew who the customer was or is. Not only are many medical personnel not training their patients in using My Health Record, they're not using it themselves, despite the fact that for many it would just be a case of ticking a box on a screen. They're not enablers. Australia has a digital health strategy. Seems to me that the COVID tracing app should sit within that strategy and could then be part of a strategic goal of keeping Australia well. Perhaps this can't be done without data risks, but we're back to the risk benefit. The public needs a very strong reason to download and use the COVID app. They need a strong statement that it works. But the fact is, we don't really know, despite what data from other countries, and this is why. We need to recognise and to address the problem of very poor health literacy in Australia. It's estimated that 60% of people have less than adequate knowledge of health literacy, which is a significant challenge in delivering any kind of health services. If people don't know their way around a physical health system, like which level of medical care to go for, they probably don't know where to go to find information on the web about an app. By contrast, also, people over 60 are absolutely bombarded with fear-based information about security, given that they are indeed a common target for scams. It's very unbalanced. These are not the people who are going to go on this government website to try and understand the app, which actually I thought was quite hard to find. They've just been schooled to say no. They're also the people who are most vulnerable to COVID. The primary justification for protecting personal privacy is to protect the interests of individuals. In contrast, the primary justification for collecting personally identifiable health information for health research is to benefit society. That's actually quite complex. There are strong rules in place in Victoria around health privacy, but they predate concepts such as a universal digital health record. And we should, as we all know, they can also be overridden if it's in society interests, like a pandemic. I could talk about this topic for ages, but I've been told to keep to time. It's a debate that keeps coming back to the interests of the individual versus the interests of the community. So for today, I pose the question, why have we failed in getting the majority of people to use an app which probably does little harm, as we have heard, and may do a lot of good? We know there are imperfections, and perhaps that's partly a result of developing something that's not intrusive and has minimal implications of privacy. There are some other reasons why it may not be downloaded. I don't think that many people understand that privacy and security are actually different. Probably one of the biggest privacy issues in medical care in Australia is medical notes going astray, getting left in the back of cars or the taxi or lost in the hospital. It may or may not be a security issue. It's certainly a privacy issue. When I talk to people in rural areas in where I live and ask them about the app, they say, I don't want the government having my information. That's all it's as simple as that. And there are mixed messages. Where there's trust in the government, people are hearing that it's safe to go out again. So why use the app if it's safe to go out again? Again, this is a gross overestimation of population's health literacy. I think it's a very mixed message. In late March, Simon Dennis and his colleagues at the University of Melbourne posted a hypothetical scenario to a sample of Australians, asking if they'd download a contact tracing app released by the federal government. 70% responded in favour. When he next checked, which I think was the end of the first week of May, following the release of COVIDSafe, it showed that 44% of respondents at the time, of his respondents, had actually downloaded it. Their ongoing research, led by the Complex Human Data Hub of the University of Melbourne School of Psychological Sciences, surveyed the Australian public to understand their opinions and the use of the COVIDSafe app and other possible government tracking technologies. Their research is helping us understand what's holding people back, and we need to understand that. They also asked all respondents what technology they thought COVIDSafe used. This is quite important, I think. 60%, only 60% of their users correctly responded with Bluetooth. Others responded with location data, mobile phone towers, or that they didn't know. This breakdown differed between people who had downloaded the app and those who did not. For the people who sign up, some of the most vulnerable people really don't understand the terms being used. Most of you will have seen funny videos about teaching your elderly parent about Bluetooth. Where is the Bluetooth? It's somewhere in the house. And having her or him look around for it. Having run a teleaudiology company for 10 years with that peak age group being over 60, our customers often didn't have the familiarity with technology which we're taking for granted. They don't understand the words. They don't understand the vocabulary that's used. They might get an expert in to download to pair a Bluetooth device for them. If they do understand Bluetooth a little bit, they keep it turned off to save the battery. They don't get past that screen on the app that asks them to know the device location because they know that it mustn't. Their peer networks told them not to. People may really not understand that it's necessary to download this app. Perhaps most of all, we don't really know how well the app works or will work and that it will meet its intended purpose. And we can't convey that to the public because we don't know. The number of downloads is absolutely not the same as the number of active users. And there are two aspects to do with that. One is we don't understand fully the virus transmission, and the other is to do with adherence or compliance. And I'll finish with this. Generally, there is very poor compliance in Australia with medical device. About 75% of patients are non-compliant in one way or another, from not filling their prescription to not taking a complete course of medication, or indeed to not using their hearing aids. And this is when they already know they're sick or have a problem. So we're being wildly optimistic to think that well people will use the app properly, even if they understand how to use it. My overall view is the same as the other speakers, is that people should download the app, but we should be working with government to help them keep their security promises, working with the public to help build confidence and education, and working with researchers to understand the app's effectiveness. And looking at the successes, failures, and opportunities that coincide and are coincident with my health record, which I'm bringing back in again. The federal-state divide's a bit of a barrier to good health policy in Australia, but actually this is where digital can help us. So I'll finish with that. Download, but be mindful we've got to help people use it.
Thank you so much, Elaine. I think you have pointed out that we are a group of people who are discussing this in quite different terms, and if we actually want those outcomes, those health outcomes, we've actually all got a role to play as advocates for technology. Many people across this call have had to go on the journey of explaining this app and the rest of it. So thank you so much. And again, it really helps bring it back to the human-centered approach and the adoption. We know there's a tendency in technologists to develop something and then, wow, we want people to use it, but people aren't a perfect use case. So, I think part of the discussions and thoughts that I've been coming through in questions and some of the discussions have been, 80% is good enough because nothing's ever going to be perfect, and it is going to have to. I saw some review that basically there had been problems, there has been feedback loops, they have done updates, and it's even people understanding that an app is actually by its nature constantly updated and has bug logs and has all of those different things inbuilt through those different platforms that it's being deployed, and they're really simple. They're used to having their apps updated, so it's just normalizing some of that understanding of what they have. So I've got a couple of questions that came in advance, and yes, we do have Elaine's notes, and if Paul or Ian have any notes, or we will have a recording of this for you as well for people who weren't able to join us originally or have had to pop off. We did put a call out for questions, and I've just been trawling through them and trying to maintain my eye contact. I will say that Anthony Wood had asked a question about has the government kept their promises about releasing the source code and passing the privacy legislation controlling the data. Now, I think Paul and Ian probably did both answer that, but I did note, Paul, that you said that the server side has not been released. What is the difference for us to understand what that means? Because, Anthony said, has it been released? But if there's two parts to it or what's the challenge there?
Sorry, the lag is for the administrator taking me off mute. So this is an application using a client-server architecture. The client is what operates on your mobile device, and it's transmitting the data at the user's discretion back to the server. And so the source code for the Blue Trace protocol, which this application is based on, is the same protocol that is in the Singapore app called Trace Together, and which the UK NHS are also basing their design on. So that Blue Trace protocol is released under an open source license called GPL v3. And so the federal government, by basing the code on that license, had an obligation under the license that it came from to also release their source code. However, the server side wasn't under the same license. And so there isn't that same obligation. Some of the other countries have chosen to release their server-side source code, which I think would be a good step for the federal government to follow. That doesn't, however, mean that the positions with confidentiality, integrity, and availability of the data generated via the application on the mobile device are in any way different. We know the application is generating and storing data on the device, and we know that it's only transmitted to the central server if the user chooses to do so, and the user has the option to opt out at any time. So the fact that the source code of the server is not available doesn't mean that we haven't been able to do some level of assurance of the confidentiality, availability, and integrity.
Great, thank you for that. That was actually, I understood that. We also had a question just regarding from Alison Harcourt, who's our Pearcey Hall of Famer in Queensland. The information collected in the app could be of interest to outside groups for financial or other reasons. And how can we be confident there's adequate protection against such misuse? She's not querying the app itself, but the data it contains. And maybe Ian, because it will be coming across to a state entity, I don't know what engagement you might have or a perspective to bring from a New South Wales perspective. I know the legislation has been put in, but I suppose it is that point of once it has been surrendered by the person, as Paul just said, it's only once that data is released up, but that then gets sent to a state-based health authority to look for to actually just basically conduct the tracing that they would have been doing if they got a form off people who turned off a boat if they'd filled it in.
So, Kelly, whilst it's a specific example of data sharing associated with COVID trace, but first of all, the legislation, draft legislation, speaks about some pretty hefty penalties. Secondly, everybody knows how sensitive it is. And thirdly, people take privacy very, very seriously. One of the challenges over the last 4 or 5 years of my day job has been getting people to share data and understanding what their obligations are to actually share as opposed to hold back. And in some cases, the ambiguity associated with legislation really gets in the way. And so as a net result, you get because of the Privacy Act, I can't share it with you, the BOTPO reason. What's planned makes it really clear that you're not supposed to use it for what you're not supposed to use it for. And there are real personal penalties associated with that. But everybody I've ever met in government is so concerned about doing the right thing with the data that there's a very natural cultural tendency to really strictly use the data for the purpose of which it's intended. Take that up to health data, and that spectrum between personal information and sensitivity, you really are in the top right-hand corner, very sensitive, very personal. It's a very careful process that people think their way through before data is allowed to be released. And building governance frameworks that do the right thing by the letter of the law, but also do the right thing by the spirit of the purpose, and with the ultimate objective of building and maintaining trust in government use of data, means that I have never seen reckless behaviour with use of data. And in this case, everybody knows that it's sensitive and highly personal. So the prohibitions are good. They certainly describe things. The prohibitions around discriminating against people who do or download the app are also good. But ultimately, there's a whole lot of, it really is about that trust aspect again, trusting appropriate use by government, but also trusting appropriate use of data and knowledge that can be inferred or derived if you don't have the app, if people ask you to show them that you've got the app. The potential exists to discriminate against people, not by government, but by service providers, by shopkeepers, by whatever the case may be. Ultimately, it's about building trust that we won't do that, and that the prohibitions are effective enough to make it clear that that's what we're supposed to do, but really us all really working together to ensure that the app is technically useful, as well as being societally useful, as well as driving the appropriate behaviours that we all need to actually to beat this.
Indeed. Thank you for that. I mean, I think maybe some of the underlying, we discussed in our paper that there was an issue of trust with government, but we seem to have trusted private sector with our data, as you mentioned when we talked earlier. And so we seem to get who we're trusting around the wrong way some of the time, I think. So there was another question, and we sort of touched on a little bit about, this is from Joseph Brooks, that there have been a number of different approaches to contact tracing apps around the world. And Paul, you mentioned that this is based on the Singapore, and it's also the protocol that will be utilised for the NHS in the UK, who definitely needs it. So around the world, between Bluetooth versus location, centralised versus decentralised, did Australia take the best approach with its COVIDSafe app? And have you seen any other countries doing particularly well or poorly with a different approach or contract tracing, or is it too early? I mean, you know, I know we're very early into this piece, but everything is moving very rapidly. And I think maybe because of the point of it being an open source approach and some international frameworks, that will help that development and deployment. So whatever's learnt now will get, you know, benefited to the next deployment of it. So by nature of the technology, but can you talk about those different dimensions that could be the approach to a tracing app?
Sure, thank you, Kelly. So what I'm aware of is that China took a mobile phone location specific approach, and their application has a QR code which can be scanned, so a form of digital surveillance. Taiwan, which has perhaps been one of the most successful in containing the spread of the virus, has taken a big data analytics approach, using not just health data, but also GPS data. So again, another form of digital surveillance, built on the back of their learning in managing the SARS outbreak. South Korea, again, electronic transaction phone data, so another form of digital surveillance. India is using Bluetooth and GPS. Israel is using GPS data, and Singapore and Australia and the United Kingdom are using this Bluetooth technology. So there's various strategies that we're seeing based on the capability of the handset. Many of them you would describe as digital surveillance, where the user's location is being recorded. I think the strategy we see with Singapore, Australia, and the United Kingdom is very different to the other economies, and that they're simply using the technology of Bluetooth to determine a proximity event and not actually track location. And there's definitely a lot of work that's gone into the design of the BlueTrace protocol to ensure that there's a high level of anonymity, and at no point is the temporary ID that's used to identify a handset decoded or coupled to an individual until you've made the personal decision to submit your proximity data back to a central service. So again, the user's in control of that data at all times, and it's not location data, it's proximity data. I think what we see with the large ecosystems of Apple and Google is that there's an opportunity to do even further decentralization. The reason that the data proximity records are uploaded to a central server is so that that matching can be done. And with a different underlying protocol, there's the ability to do a fully decentralized mapping, which would eliminate the need for a central server. In hindsight, that is certainly, I think, something that the technical community of Australia would prefer to see. So there's no reliance on a central authority to do the matching. However, we need to consider the efficacy of deployment. And if it's taken us this long to get to 5 million downloads, had we waited for Apple and Google to deliver a new API for their handsets, we could have missed a long period of time of contact tracing, which I think would have really impeded our ability to benefit from it. I can only speak to the security and the approach that different economies have taken. I can't speak to the efficacy of have we actually used the data to do effective contact tracing though.
Well, I think that's going to be the next phase, of course, you know, and, you know, we know we've had that process of gathering it. It's always the way, isn't it? We spend so much time gathering it and then somebody forgets to actually do anything with it, or they don't have to do anything with it, or that's if they give it to you, Ian, isn't it, really? So one of the other questions that sort of came out from two different places, from Steve Aquilina and Bill Cayley, was around the impact of the US Patriot Act on privacy and the data collected. In relation, it's quite a long couple of different question dimensions, and I'm sort of synthesizing it. It's around possibly to do with the issue around AWS being a subsidiary of a US company, and what other implications there might be in regards to that. We know, we've discussed this as a panel, it's very much a legal discussion possibly, but from a technical perspective, if anybody has any thoughts on that and any experience that they've seen in regards to that particular issue of that we are dealing with these different jurisdictions and the like. Over to anybody who'd like to try.
Yeah, let me go first on that one, Kelly. Thank you. So the Patriot Act and the Cloud Act are appropriate concerns. We do hear the federal government continuing to provide guidance on their perspective of the legislative frameworks that govern the data inside AWS. So the context is any US cloud operator is subject to compliance with the Patriot Act and the Cloud Act, which means irrespective of geography, they would need to present data to a federal agency should they ask for the data to be made available. There is a framework which would allow Australia to be called a qualifying jurisdiction under US law, which would assure that legislation is in place to protect Australian data hosted by a US cloud operator on Australian soil. And that legislation has not yet been passed. But the ABC reports that a spokesman for the Prime Minister confirmed that Australia, whilst not yet designated a qualifying jurisdiction under US law, has insisted that the data would remain in Australia, even without yet being defined as a qualified foreign government under the Cloud Act. Australia already ensures data from a range of government agencies, including our intelligence agency, the Australian Signals Directorate, is kept in Australia and appropriately protected.
Mm-hmm. Mm-hmm. Okay, great, thank you. Is there the others? Ian?
So while the conversation's been going, I've been looking at the chat, and the point about trust has come up quite a few times, and I agree this is an appropriate concern. I have the great fortune of being married to a barrister, and we often discuss the engineering world versus the legal world, and I've been involved in quite a few conversations where there are real concerns being raised from a legal perspective and from an ethics perspective and from a trust perspective. There are a couple of really important things to just make sure we do understand. You can't have trust without competent, technical, responsible behaviour. And you've got to be able to demonstrate you've got the skills, you've got to be able to demonstrate you've got the governance, you've got to be able to demonstrate that you actually are doing what you said you would do. Big overarching questions about whether or not the Patriot Act would apply in an Australian context where Australia would actually release data which is known to be sensitive, which is known to have high levels of personal information, is a different issue altogether from a legal framework of saying that it's theoretically possible. But we absolutely need to have the conversation. We absolutely need to put it on the table and say this is something which is causing concern. And just as all of the other aspects about technical capability or governance frameworks or reliability or appropriate use, they are all genuine concerns. We should not disregard them. But on balance, I still don't think it's enough of a reason to not download the app. And I've had a few conversations with ACS colleagues and with people at home and people over Zoom dinners about, on balance, whether I think this is the right thing to do. And on balance, I do.
Actually, on that point there, Elaine, you know, you are, that's where you came to, and in the end, often in a health context, the application of the technology has to be around that benefit versus risks. So, and as we're hearing about trust is a human behaviour.
Yeah.
And yes, you have all the regulatory, the frameworks, the governance and the like, but in the end, it's still a personal decision and it's a personal act. And I think one of the themes that came out of our discussion is maybe we have to suspend our individual to have a collective benefit. And that's part of that balance idea there you're talking about, Ian. But, you know, in the context of other health adoption, you know, yes, we know that there's a, you know, that we're talking about, actually somebody's mentioned the app is pretty much the vaccine. This digital vaccine is one of these phrases I've heard, because we're not going to have an actual vaccine for a while. So that idea about that risk benefit and the application of the technology, which may not be perfect, but life isn't.
If I could just make a comment there, I think it's significant that that the NHS are using the same technology, because there is just massive trust in the NHS. I think the studies in Britain show it's kind of the #1 most trusted brand of anything. So it'd be interesting to see if that has any spillover effect here.
And indeed the adoption rates there, and I think we've had commentary in the chat there around trust and relation to government. And so we do see a very big difference. And I wouldn't be surprised in America if you have different states coming out with their own apps. Not in that, there's not going to be a federal solution on this stuff. So I think it's an interesting thing. I'm just looking through to see if I had the other questions. There was a comment and question earlier about the updates. I made the comment about automatic updates. Paul, I don't know whether this is something you might be able to address. I'd suggested it because it's a behaviour that we're used to, that we have automatic updates set on our phone, but have there been any trigger to update, or is it just in the background it automatically will? Or is it dependent on what your own personal settings are on when you know, some people don't have updates, they want to do it manually and those types of things. How does that element work, as we know that they have been rolling out, DTA have been rolling out some of these bug fixes?
Yeah, so both of the ecosystems, Apple and Google, have their effective store repositories for the applications, and the developers can make the application configured for availability to devices, and then the end user has the ability to either subscribe to that application as an auto update or something they would want to manually update. And certainly as a user of the application myself, I've received 3 updates since first installing the application, all seamlessly within minutes after the latest version's been made available.
Yeah, I've received a lot of notifications. Unfortunately, I don't read them. I just do that. And I'll say this, I spent 2 days in a COVID ward, and I turned up to the ward and it said nobody can come in, but my brother was in there and I needed to be his advocate. And I put on the app and I had a proof of I had to get a proof of my flu vaccination to be able to do this. So there's other types of health data is now becoming required, but not actually being available. So it's an interesting time we're living in within that area. There is one other question that's popped up here, Bill. I did do the first part of the Patriot Act, but you might have another question here around, we also do not know the security profile or evaluation levels of the AWS systems, and the VM used to host the server application database. Such databases are honeypots of criminals and other groups. We should be told about the evaluation systems of the AWS cloud system. So it's very much a specific around that cybersecurity angle and a concern around data centers. Any thoughts on that one, Paul?
Great to be fielding a question from Professor Bill Cayley, who's perhaps Australia's leading expert on cryptography and international security relationships with the United States. And he's absolutely right. There is not sufficient transparency on where inside the AWS infrastructure the application is being housed. The government's made statements to assure us that it is falling within the same AWS infrastructure that is hosting other mission critical applications for the government. But because they haven't made the source code available, and because there isn't that level of transparency, we're not able to verify it, as establishing an evaluation assurance level, as Bill rightly points out, we should be doing.
Yeah.
Having said that,
there will be a lot of review of this, because I think, as Elaine really, you know, it was a nice perspective there, Elaine, talking about the fact that this really is a startup within government. You know, it was so fast, so lean, having to get in there and deploy something. There has rightly been a lot of questions about procurement and the like, but, you know, Ian, we've worked on procurement for many years now and hacked it a few times, and you know, it is quite amazing, and I think it will be a really interesting reflection back. And I think this is part of the conversation where Pearcey will be heading next, is actually talking about the self-reliance of the sector in Australia, the ability for us to make sure that we are supporting our sector. It has sort of highlighted that we're interconnected globally, technically, but we also then actually have to really look at our own sovereignty and building out our own capability. And we definitely have the ability to do that. I think there's going to be some new opportunities for this tech health space. I think it has been a tipping point for telehealth, Elaine, as you said, you know, to see whether on these new adoptions will be able to be maintained and continued. I hope they are. We've spent, you know, quite a lot of time as Pearcey over the years and with the Australia 3.0 group looking at how do we've got great technology in this country. We're just really bad at adopting it. and Dennis Tebbett will attest to that with the plan for the adoption bridge. And, you know, I think Wayne just put forward a question there around the COVIDSafe, and that's something that Ian, you picked up on was, you know, we'll start seeing that you will be denied service to a cafe if you won't have the app on, or if you won't hand over your phone number and your contact details. Or would it be that there's a new opportunity for credentialing for companies to say, you know, and this is part of, I think, one of the big remits for businesses in the economy to open up is actually, and you see it from the federal government on all of the different WorkSafe regulations that businesses need to put in place to actually protect their workers and their customers. And so we might see some of those things, and, you know, we are seeing some different technologies around, you know, permits for working, and, you know, to visit an aged care facility or anywhere, you're going to now have to have a verification of a flu. Now, you don't get that. It's like I had to get an email from, I was amazed, I got an email from my doctor's surgery. You know, it's taken, I don't know, 10 years for them to actually use email. So we're seeing some really interesting shifts. We want to make sure as Pearcey that we keep these conversations happening. We are really looking towards continuing this, and we appreciate, I'm going to wrap it up now, we're appreciating how many people are involved and are interested, and, you know, and the sense of openness and discussion and frank, honest exchange of ideas. And people came to this with a very firm idea that they were not going to download it, that there was no way in hell. And they have thought it through, they've discussed it, they've heard evidence, and they've changed their mind and are reassured through an intellectual process, not just an emotional process. Yes, certainly, Elaine, you can say I didn't.
No,
yeah, I was going to come around for a wrap-up topic.
Oh, well, this isn't so much a wrap-up.
As a takeaway, and something that we know we want to keep talking about, and what do we want to do next type of thing. Because we sort of want to keep moving this forward as we still discuss these opportunities for, you know, actually embracing technology to create the post-COVID economy we want and society. So, Elaine, your final word.
My final word is, I really think we must be very, very careful not to discriminate against, let's say, the over 60s. I think the most vulnerable people are the ones who are least likely to use the app. They may download it, they may not use it. So I think that the work that we're doing in Pearcey, it's really important to do this incredibly robust technical work and security work at one level, but I think we should also look very, very strongly at, can we actually help in the marketing and the communications and the help? Because otherwise we will have effectively the right people not using it.
Yep, great point. Good point to follow up with an initiative there. Happy to join you on that. Ian, what's your final word on it?
Ultimately, it is about trust and getting that balance right. And yes, we need to make sure we do the technical work, and there should be an offer of help. There should be an offer of scrutiny. There should be an offer of review. But ultimately, we are going through extraordinary times. We have been so incredibly lucky in Australia. All you have to do is look internationally and see how the world might have been different. And a large part of that has been working together. And this is an example. I think we need to work together, and we should all be willing to help to iron out any deficiencies or improvements or to make improvements to both the systems, the governance, and the technology.
Indeed, thank you. And Paul? Yeah, so from my perspective, trust is truth and transparency over time. And thank you. And as a technologist, the fact that the government have made the source code available really has gone a long way for me to build some trust in their transparency. There's a lot of room for improvement, as Bill alludes to. We could definitely get access to the server-side source code and help establish trust in the technical community in Australia that's got well implemented. And there's certainly an opportunity for, as we've seen with a number of software developers already, for us to continue to collaborate with the government to improve the defects that have already been identified, to improve the performance, the Bluetooth issue. But the government has yet not embraced the development of the application like an open source software project. So whilst it's following the letter of the law, it's not yet following the intent of an open source framework. So I think hopefully that's what's to come, so that we can all collaborate to make the application not just better for Australia, but for any other economy that chooses to take this strategy.
Well, thank you very much for each of you for sharing your perspective. I think it's again teased out some of the different nuances that we need to look at with these things and think deeply about them and question. There's nothing wrong with questioning because that's the only way we're going to improve. So I'm going to wrap it up at 4:58 and I think my team will be very happy with that. I appreciate everybody's contribution in advance of the questions and the some that have come through now. We really would like to thank you for your time. I'm actually just going to hand over to our chair, Wayne Fitzsimmons, to just do a little close there.
Well, thank you very much to everybody that participated. I think the points that Ian and Paul and Elaine made and Kelly has underlined, this is an opportunity for the tech industry to come together to support the rest of the community. We're a horizontal. And to Ian has made some initiatives in this area in particular, joining with Australian Information Industry Association, with the Engineers Australia, and other organisations where we're making contact with the academies, with Communications Alliance, TELSOC, a number of communities. There will be one or two areas where I think where we can focus together, not to encroach on each other's areas of focus normally, but I think we have an opportunity to build the resilience into our society that we know we need, and tech will play a major part. Thank you very much.
Indeed, a very good point to end on. Thank you very much, everybody, and have a good rest of your day.